Good day, future nurses. We are the group 4 and we are about to report our answer in our worksheet number 1. So, I will be discussing the part 1 matching type of the stepping in section of our worksheet. So, in column A, it is composed of the definitions, and in column B, it is composed of what the definition is referring to. In number 1, the study of how the body and its parts work or function, our answer is physiology. So, for example, the heart. The study of how the heart regulates blood flow to supply oxygen to other organs in the body is called physiology. In number 2, the term that indicates all chemical reactions occurring in the body, our answer is metabolism. So metabolism describes all the chemical processes that go on continuously inside your body to keep us alive and our organs functioning normally, such as breathing, repairing cells, and digesting food. In number 3, a form of life composed of mutually interdependent parts that maintain various vital processes, our answer is organism. So a perfect example of an organism is us humans. When we say interdependent parts, it means that all parts of our body is depending on each other, and it means it takes the help of another part of our body to make the other part work. In number 4, the study of the structure and shape of the body and its parts and their relationships to one another, our answer is anatomy. So, for example, an organ which is the heart, the study of the types of tissues found in the different parts of the heart is what we call anatomy. Number 5, the body's ability to maintain relatively stable internal conditions even though the outside world is continuously changing, our answer is homeostasis. So it is very important to our body because it maintains stability while adjusting to conditions that are best for its survival. Number 6, a group of organs that work together to accomplish a common purpose, our answer is organ system. So an example of an organ system is the digestive system, respiratory system, nervous system, and etc. In number 7, elimination of carbon dioxide by the lungs and elimination of nitrogenous wastes by the kidney, our answer is excretion. So, in simple words, excretion means to eliminate or a process removing metabolic waste from our body. Number 8, provides new cells for growth and repair at the cellular level. Our answer is reproduction. An offspring that is produced by two individuals having intercourse is the best example of reproduction. Number 9, ability to react to stimuli, a major role of the nervous system. Our answer is responsiveness. So, stimuli, a word stimuli in the context of science is a stimulus, is anything that makes an organism or a part of an organism react in some way. Number 10, walking, throwing a ball, riding a bicycle. Our answer is movement. So anything that makes changes of position or location is what we call a movement. Number 11, the tuna sandwich you have just eaten is broken down to its chemical building blocks. Our answer is digestion. So when we say chemical building blocks, it refers to the minerals or the lipids, proteins, carbohydrates, and nucleic acids. And the primary function of our digestive system is to digest food and to break down to its chemical building blocks so the minerals will be distributed throughout our body. So the structures of the body are organized into successively larger and more complex structures. So it starts with the chemicals. The next our the next one is the cells. Cells, for example, are the white blood cells, the red blood cells, and the nerve cells. Next is the tissue. An example of a tissue is the epithelial tissue, the connective tissue, the muscle tissue, nervous tissue, and etc. In number 3, the organ. Number 14 rather is the organ. So organ, for example, is the stomach, the heart, the lungs, the brain, and etc. And for the number 15 is organ system. Example of an organ system is the digestive system, respiratory system, nervous system, etc. As what I have told kanina. In so that's all for my report in the part 1. The next part, which is the part 2, which is the anatomical landmarks, will be discussed by Miss Japay and Miss Fronteras.
Thank you, Miss Guinocor. So let's proceed to anatomical landmarks. We will present to you the anatomical terms as well as the simple terms of the said body parts for you to easily understand or familiarize their location. Number 1, frontal or forehead. Number 2, ocular or orbital or eye area. 3, nasal or nose area. 4, buccal or cheek area. 5, oral or mouth. 6, mental or chin area. 7, cervical or neck region. 8, acromial. 9, sternal or breastbone. 10, axillary or armpit. 11, pectoral or mammary or at the breast area. 12, acromial or shoulder. 13, brachial or arm. 14, antecubital or front of the elbow. 15, antebrachial or forearm. It is located between your elbow and your wrist. 16, abdominal or abdomen. 17, umbilical or navel. 18, pelvic or pelvis. 19, inguinal or groin, area where thigh meets the body trunk. 20, coxal or hip. 21, pubic or genital. 22, carpal or wrist. 23, pollex or thumb. 24, palmar or palm.
For continuation, number 26, femoral or high, patellar or kneecap, 28, crural or leg, 29, fibular, 30, tarsal or ankle, 31, dorsum of the foot, 32, digits or phalanges or toes or digital phalangeal, 33, hallux or great toe, 34, cephalic or head, 35, otic or ear, 36, occipital or back of the head, 37, scapular, 38, vertebral, 39, olecranon or back of elbow, 40, lumbar, 41, sacral, 42, gluteal or buttock, 43, perineal, 44, manual or hand, 45, popliteal or back of knee, 46, sural or calf, 47, calcaneal or heel of foot, and 48, plantar or sole of the foot. So that's all the answers for part 4. I mean part 2.
Let's proceed to the next reporter, which is Miss Gato and Miss Gapasin.
Thank you, Miss Japay. First of all, good afternoon, Miss. Good afternoon, classmate. I am Jackie Gato, and I will be the first one who will present our answer in part 3, which is the directional terms, body planes, and sections. So for the first part, which is the letter A, this is the anatomical position of the body. Our first answer is superior or carnal or cephalic. It is towards to the top of the head. Number 2 is posterior or dorsal. It is towards the back of the body. Number 3 is an- anterior, which is in front of or front. Number 4 is proximal, which is close to the origin of the body part. Next one is number 5, which is the distal. It is farther from the origin of the body. And the last one is inferior or caudal, which is away from the head end or towards the feet. Please, next slide. Next is for the letter P. This is the anatomical planes of the body. Our first answer is frontal or coronal plane, which is located at number 1. It is the vertical plane running from side to side, and it divides the body or any of its part into the anterior and posterior position. Number 2 is the oblique plane, which is located at number 2. It is a plane that is in any type of angle other than horizontal or vertical angle. Number 3 is transverse plane. It is the vertical plane running from the front or the back, and it divides the body into the upper and lower parts. Number 4 is the parasagittal plane. It is a plane that's situated alongside or parallel to the mid-sagittarial plane. The fifth one is the mid-sagittarial or median plane. It is a vertical plane running in front to the back, and it divides the body to any of its part into the right and left side. Number 6 is the cross section. It is a transverse out through a structure or tissue. And for the last one is the longitudinal section, which is the section done by a plane along the long axis of the structure. So next slide, please. So for the last part of B, which is the body cavities, our first answer is cranial cavity, which is space inside the bony skull. It is where our brain is located. Number 2 is the spinal cavity. It extends the cranial cavity to the end to the spinal cord. It is where our spinal cord is located. Number 3 is dorsal cavity. Dorsal cavity contains organs lying more posterior in the body. Number 4 is thoracic cavity, or also called as chest cavity. It's separated from the rest of ventral cavity by a dome-shaped muscle or a diaphragm. And number 5 is the abdominal cavity. Abdominal cavity is a cavity that contains the stomach, liver, intestine, or other organ. And number 6 is the pelvic cavity. Pelvic cavity is a funnel-shaped space surrounded by the pelvic bones. It contains the reproductive organ, the bladder, and the rectum. Number 7 is the superior mediastinum. It is, it is the central compartment of the thoracic cavity. Next is the pleural cavity. It is the space enclosed by the pleura, which is the thin layer tissue that covers the lungs. Next one is the pericardial cavity. It is the space between the parental and the vertical layer. And the last one is the abdomen, abdominopelvic cavity, it, which is the largest cavity in the body. So, kato lang.
Okay, so hello everyone. I am Victorian Gapasin, and we will discuss about the major organs that is uh, in the cavities. So the first one is the thoracic pleural cavities. The major organ that is located there is the left and right lung. Next is the mediastinum, which are the trachea, esophagus, thymus gland, and heart. Pericardial cavity. The major organ is heart. Abdominal cavity, small and large intestines, stomach, liver, gallbladder, and pancreas. Pelvic cavity, urinary bladder, urethra, ureters, anal canal, rectum, and sigmoid colon. Next is the cranial cavity, which is the brain, and vertebral cavity, which is the spinal cord. Epigastric, which are the esophagus, stomach, liver, spleen, pancreas, right and left kidneys, ureters, and suprarenal glands, small intestine, transverse colon. Umbilical, stomach, pancreas, small intestines, transverse colon, right and left ureters. Next slide, please. Hypogastric bladder, a part of sigmoid colon, anus, uterus, and ovaries for female and prostates for male. Right hypochondriac, liver, gallbladder, small intestine, ascending colon, transverse colon, right kidney. Left hypochondriac, stomach, left kidney, liver, pancreas, spleen, descending colon, transverse colon, and a part of small intestine. Right lumbar, gallbladder, small intestine, right kidney. Left lumbar, a portion of small intestine and descending colon, and a tip of left kidney. Right inguinal, small intestine, appendix, ascending colon, cecum, right ovary, and right fallopian tube. Left, eh, left inguinal, descending colon, sigmoid colon, left ovary, and fallopian tube. Right upper quadrant, gallbladder, duodenum, right kidney, distal ascending colon, right lobe of liver, pylorus of the stomach, head of pancreas, hepatic flexure of colon, right half of the transverse colon. The next part will be discussed by Miss Fronteras.
Mm. So, part 4 medical prefixes and suffixes. Before we discuss ano, prefixes and suffixes and its meaning, a prefix is a word added to the beginning of a word or base word, and suffixes are placed at the end of the words to change the original meaning. In medical terminology, a suffix usually indicates a procedure, condition, disease, or part of speech. So, brachii, meaning of or relating to the arm. Epi, exam, above, upon, or on. Example, epicardium is a serous membrane that forms the innermost layer of the pericardium and the outer surface of the heart. Endo, meaning within, inner, inside, or containing. Example, in endospore formation, the bacterium divides within its cell wall, and one side then engulfs the other. Hypo, meaning below normal, under, or doubt. For example, you don't have a fever if your body temperature is below 38 degrees Celsius. Cephal, or meaning head. For example, I don't have enough sleep last night. That is why when I woke up earlier, I have headache or cephalgia. For continuation, please proceed, Ms. Garcia.
Hello everyone. Hello ma'am. I'm Garcia and I will continue to discuss the medical and prefixes and suffixes. A or an means not, without, or less. Example, analgesia can less the pain during labor and vaginal delivery. Site means cell. Example, leukocytes are white blood cells that help your body fight germs. Itis means inflammation. Example is tonsillitis is inflammation of the tonsils. Ectomy means removal. Example, she will undergo mastectomy tomorrow. And that's all. To proceed to part 5, Miss Gonzaga will discuss the organ system.
For the part 5, it is labeled as organ system. Let me first discuss the answers of our group in the cross section part of the crossword. So for the number 1, our answer is lymphatic. It is the major function for tissue drainage and fat transport and also immune responses. For number 4, respiratory. Respiratory contains organs and tissues that help us breathe. An organ that can be found in this system is our lungs. Number 6, it rides the body of nitrogen containing waste and conserves body water and eliminate excesses. So our answer for this number is urinary system or excretory system. An example found in this system is urethra. Number 7, nervous system. Nervous system transmits signals in our body parts. In this system, it includes brain, nerves, and sensory receptors. Number 8, muscular system. Our muscular system is composed of specialized cells called muscle fibers. For number 9, it provides supports and levers on which the muscular system can act is our skeletal system. This system includes all of our bones and joints in the body. And lastly, for number 10, our answer is endocrine. Endocrine is the system in which our body is made up of all different hormones. And in this system, our thyroid gland is one of the organs found in the said system. Next is for the down part of the crossword. So our answer for number 2 is cardiovascular. Cardiovascular is otherwise called as blood vascular or simply circulatory system. It is where our heart is located, and heart is responsible for delivering oxygen and nutrients in our body tissues. Number 3, integumentary. It is the largest organ in our body that serves as the physical barrier of our body towards the environment. Number 4 is reproductive. Organs in our reproductive system is responsible for producing offspring. In women, organs in reproductive system includes ovaries, fallopian tubes, uterus, cervix, and vagina. For men, prostate and testes and penis are organs in the reproductive system. Number 5 includes organs such as esophagus, large intestines, and rectum, and it is the system responsible for digesting our food. Our answer for number 5 is digestive system. That's all.
So hello, I am Victoria Gapasin. So in this part, we will be translating the anatomical language in layman terms. So number one, uh, it says here patient is experiencing local pain at the right medial tarsal region with numbness and pain radiating to the ipsilateral hallux region. Our answer here is the patient is suffering from pain on their middle foot on the right with numbness and soreness that is extending to their big toe. Second, patient has inflammation in the left scapular region that extends laterally and superiorly to the contralateral acromial region. Our answer here is a swelling occurred on the patient's left shoulder that develops across and upwards to their collarbone. Number 3, patient complains of sudden severe pain that starts in the medial lumbar region and extends bilaterally to the gluteal and posterior femoral regions. Uh, our answer is patient complains of a sudden severe pain that starts in the center lower back regions and extends along both sides of the buttocks and behind the thighs.
So number 4, patient has swelling at the left um, olecranon with acute pain extending distally to the dorsum. So the answer is patient has swelling at the left elbow with acute pain extending away to the backside. Number 5, olecranon is located superficially on the right thorax, 1 inch lateral to the mid-sagittal plate. Answer is a deep cut located close to the surface or the skin on the right chest 1 inch away from the center of the body. Number 6. Patient has headache with pain in the forehead, in between the eyes and the sinuses. The answer is, however, many people who assume they have headaches from sinusitis, including many who have received such, have migraines. Sinus headaches are headaches that may feel like An infection in the sinuses or the sinusitis.
Number 7, patient dislocated the right thumb and has pain radiating through the forearm to the elbow. And our answer is the patient is experiencing pain in the right pollex radiating to antebrachial and moving distally to region with burning in the lingual region. 8. Patient has located a large lump in the right breast a few inches to the outside of the nipple with discomfort and swelling in the right armpit. Our answer is patient found a cyst in the right breast a few inches to the areola along with the lymph nodes. 9. Patient has a cut on the left leg that starts at the outside of the knee, moves over the outside of the thigh, and ends at the left hip bone. Patient experiencing lateral collateral ligament. Number 10, the patient landed on the left shoulder and has pain under the left shoulder blade that shoots into the neck and upper part of the spine. Our answer is the patient landed on the left shoulder and now experiencing musculoskeletal issue that affects the neck and upper part of the spine. And now, let's continue to activity 1.b, and it will be represented by or discussed by Guinocor and Japay.
Thank you. Let's proceed to deep dive activity 1.b. Item number 1. A patient comes into the clinic complaining of an abnormally pigmented and irregularly shaped mole in the left lumbar region, just lateral to the vertebrae. Indicate on figure above where this mole likely to be found using a blue pen. For us to locate the mole, in item number 1 it indicates the specific body region, which is the left lumbar region, or a region that lie lateral to the umbilical region, and the directional term used, which is lateral or side by side or away from the vertebrae, or also known as the backbone. So we figure out that the mole is likely to be found at that area, which is that blue mark. Item number 2, Miss Monica Ginocor.
In item number 2, um, a patient was brought to the hospital with a penetrating wound on the right forearm just distal to the antecubital region. Indicate on figure above where the I, wound is using a red pen. So it is stated here that for your information, a penetrating wound means an open wound caused by objects that penetrate the body. It could be a gunshot or a stab of something that is sharp, like a knife. It is stated here that the wound is on the right forearm, just distal. So when we say distal, it refers to sites located away from a specific area, but it is stated here that the wound is on the right forearm, distal to the ancubital region. When we say ancubital region, it is an area anterior to the elbow, meaning the opposite side. When we say anterior, means front. So as you can see in the picture, the red pen is probably where the penetrating wound is. So in number 3, a car crash victim was rushed to the ER. The only identifying information the EMT or the emergency medical technicians found was a birthmark on the fibular surface of the right leg just proximal to the tarsal region. So when we say fibular surface, from the word fibular, it refers to the fibula bone, which is smaller than the tibia, that is located below the knee joint but not part of the joint itself. So, fibula is located just beside the tibia, but it is stated here that just in the surface, so obviously it is just located just in the skin, not in the fibula bone itself. It was also stated here that in the right leg, just proximal to the tarsal region. When we say proximal, it means closest to the point of origin or attachment. And the attachment that we are referring here in the given situation is the tarsal region. When we say tarsal region, it is located proximally in the foot in the ankle area. So probably um, the the birthmark on the fibular surface of the right leg just proximal to the tarsal region is what is here in what you can see in the picture there. The black mark is where the birthmark is located. Next, we will proceed to the activity 1.c, which will be discussed by my co-group.
So for the activity 1C, number one is coronary bypass surgery. Coronary bypass surgery is a procedure that restores blood flow to your heart muscle by diverting the flow of blood around the section of a blocked artery in your heart. Our answer for that is T, or thoracic, PL, or plural, and PC, or pericardial.
Cholecystectomy or the gallbladder removal. It is a process or a surgical procedure in which patient's gallbladder organ is being removed. It is due to the presence of gallbladder stones, otherwise known as cholelithiasis, and complications in the said organs are also found. Our gallbladder organ is found in our abdomen part. The answers on this part should be A and PT, but our answers are A, P, and PT. So I will just discuss the difference between the three. A stands for abdomen. Our abdomen is the largest hollow space in our body. It contains different organs such as stomach, liver, gallbladder, spleen, pancreas, small and large intestines, kidney, and adrenal glands. P for pelvic cavity. It is below our abdomen, and it is surrounded by our pelvic bones and contains urinary bladder, rectum, pelvic genitals. PT stands for peritoneal cavity. It is the space within our abdomen.
For the last, which is the spinal tap, it is also called as lumbar puncture or LP. It is used to remove a sample of cerebrospinal fluid or CSF from the subarachnoid space in the spine. Our answer for that is C, corneal, and V, vertebral.
Number two, if a baby is examined with esophageal alopecia or the developmental disorder in which the esophagus fails to connect to the stomach, the baby needs a surgery. In most cases of esophageal alopecia repair, the surgeon cuts through the abnormal connection between the windpipe and esophagus and then sews together the two ends of the esophagus. The windpipe is also repaired. So, the survival need for food and water is threatened if the baby cannot have a surgery immediately because newly born babies cannot take solid food yet, so they are only relying to the milk as the source of food and water. And also, milk contains calcium, riboflavin, phosphorus, vitamins A and B, potassium, magnesium, and zinc.
Next is for the number three. Our answer is even if the children were wearing lap belts, their abdomen or stomach are still exposed. This area is vulnerable to damage since it's only protected by trunk muscle, unlike other areas that had hard covering like ribs, pelvis, or stool. The abdominal portion of the body is vulnerable due to its hollow space and it is not protected by hard covering. So to continue our discussion for reflection, Ms. Garcia will further discuss it.
So, first for our reflection, first, and primary support of knowledge. One of the most significant subject in nursing education, it is important to know the human body and know its function in its healthy state. discussing about the language of anatomy, which refers to directional terms that we, the future nurses, need indicating prescribing and patient pain or wound. In our reflection, we we believe that anatomy and physiology is important as we become a registered nurse someday. We are expected to learn anatomy and physiology, as anatomy and physiology is one of the most significant and subject in nursing education, because we all know that anatomy and physiology is all about the body structure and how does these structures work. Studying this course is essential since we have to deal every day with people lives. Through studying deeper of this course and acquiring knowledge, it will help us to assist our future patient with ease. The knowledge and skills acquired by nurse in anatomy and physiology will help them in understanding their patient health state and assisting them in regaining their well-being. That's all. Thank you.